Hi students, so this week I want to talk a little bit about coding credentials, okay? Since this is a AHIMA professional practice course, I want to talk about the credentials that AHIMA has. AHIMA is a very well respected healthcare association. It is something that when you get credentials through, that employers know you know your stuff. Okay, so there's several different coding credentials that they offer. You have some that requires degrees and some that doesn't require degrees. Okay, so for example, two of them that require degrees is RHIT. Okay, this is a Registered Health Information Technician. Okay, so these professionals usually have to have a 2-year degree. They focus a lot in administrative positions as well as an emphasis in coding. They're very good at coding, and usually most of them will do full-time coding positions. Another one you have is an RHIA. This is a Registered Health Information Administrator. This usually requires a 4-year degree. These professionals code, but they also are in a lot of management positions. A lot of them will start out with coding, and then they'll move on up towards management jobs. So they're more or less more managers and leaders with those that hold the RHIA. Okay. Then you have some credentials that you only have to have training for and experience. Some of those is a CCA. A CCA is a Certified Coding Associate that's available through AHIMA. This one is usually requires training for about 6 months, and that AHIMA also offers programs that allows you to sit for the CCA. In CCA, coding competencies are in any setting, so they usually are knowledgeable in both inpatient and outpatient coding, so you can use them for both. So that is a great credential to get because you have a wide range of coding that you can do. You can do inpatient or outpatient, so that makes you valuable within the healthcare setting. A lot of people like hiring those that have knowledge of both settings. Okay, so then you have a CCS, which is a Certified Coding Specialist. These are skilled with medical data and patient records, these coders are, and they are generally in the hospital setting, so they're more within the inpatient setting that you'll see a CCS. Okay, a CCS doesn't require a degree either, it's just from experience and also with training as well. You also have a CCSP, okay? A CCSP is a coding certified specialist practitioner, usually is what they refer it to. These specialize in physician-based settings, okay? So it could be an outpatient physician practice or a group practice or a multi-specialty clinic practice. So it's just more outpatient. It's not within the hospital, these coders. A lot of times AHIMA has coders, and they're focusing more on coders that want to code within a specific specialty. And the reason they're starting to do that is with the ICD-10, ICD-10 is going to be much more detailed, so they're wanting coders that have an interest in gearing their knowledge towards one specialty. For example, someone that maybe wants to work with a dermatologist, so they really get knowledge and gain information on the codes that has to do with dermatology. So that's an example of that. So you just coders that want to specialize in a specific area. So they are looking more towards getting credentials for that. And I think if they don't already have it, I think they're in the process of doing that as well. So that's just something I want you to think about, and something that you may want to look towards doing once you complete your degree or certificate at charter and this course. Okay? All right, thank you. And if you have any questions about that, feel free to contact me.